Welcome, welcome, welcome to Live with Lupus and Color in the Loop with the doctor is in, Dr. Ashira Blazer. I'm so excited to always have her with us. She gives us such a wealth of information. But before we do that, let me first say Happy Lupus Awareness Month. Take this time to go out and tell somebody about lupus. Let them know that you know what lupus is and you want to share that information. So before we get into talking to Dr. Blazer today, let's talk about this disclaimer that we always do, okay? So let me add that to the screen so you can understand what's going on here. So the information or answers provided during Lupus in Color videos and live events are not meant to be used as a substitute for professional medical advice. Information provided may differ from your physician's advice. The information provided and presented is for educational purposes only to support attendees in the quest to learn more about a most silent disease. Please check with your own physician before changing anything in your treatment plan. The information contained in any video or live event is not intended to recommend the self management or health problems or wellness. It is not intended to endorse or recommend any particular type of medical treatment. Should any attendee have any health related questions, promptly call or consult your physician or healthcare provider. No information presented should be used by any attendee to disregard medical and or health related advice or provide a basis to delay consultation with your personal physician or qualified healthcare provider. Persons accessing this information assume full responsibility for the use of the information and understand and agree that Lupus in Color or its presenters are not responsible or liable for any claim, loss, or damage arising from the use of the information. I always like to put that out there because I want people to know we are just providing something for you that can educate you, that can help you make your own choices with the help of your doctor. So, without further ado, I see Dr. Ashira Blazer is in the room. I'm going to bring her up to the stage and we're going to talk to the doctor because the doctor is in. Give me 1 minute. Hey, Dr. Ashira.
Hi, how are you?
I am good. How about yourself?
I'm doing wonderfully today.
Awesome. Awesome. I'm so happy to have you. I always get so excited when you come on with us because you give us so much great information.
Well, thank
For
you.
for those of us that don't know Dr. Blazer, why don't you tell us a little bit about you? Everybody should know about Dr. Blazer, number one. But I'll give her the opportunity to share who she is with you.
Well, thank you. Yeah, so I'm Ashira Blazer. I am a rheumatologist and assistant professor at the Hospital for Special Surgery, and I specialize in lupus in African ancestry populations. So not only do I see patients, but I do quite a bit of research, and it's always a wonderful day when I get to join you.
Oh, thank you. I love it. I love it. I don't remember how we got connected, but I love that we're connected.
Right. It matters that.
Amazing. It's amazing. So
Yeah.
today we're going to talk a little bit about coping with lupus. Is that
Mm,
all right with you?
absolutely. Absolutely.
Okay, good. So let's get into it so that we don't take up too much time. So what are some effective strategies for managing lupus flares and minimizing their impact on our daily lives?
Yes. So I would say consistency is key.
Mhm.
And lupus is one of these diseases, as you know, that some days you're going to feel great, some days you're going to feel terrible. It will flare, it will get better. You can have inflammation, you can also have fatigue, right? And so lupus is up and down, up and down. And what we need to do is be consistent. That
Mm,
means consistent with our doctor's visits, consistent with taking our medications, consistent with our self-care plan, consistent
mm,
with our sleep,
mm.
consistent with our spiritual practices, because I know lots of my patients have a really bad turn and then they start feeling better and then all of a sudden
All
they're
that stops.
all that stops, right? But it's a wellness journey. Lupus
Mm.
begs you to take care of yourself in every way you know how,
I
and you
love that.
have to make that call.
I love that lupus begs you to take care of yourself. That is an awesome statement
Yeah.
because it's true. Everything you stated was so true. Very
Mm,
on point.
yeah.
That's important. And doing those things will minimize the impact of lupus on our lives. Just the littlest things like getting 7 to 9 hours of sleep.
That is a huge thing. You would be surprised how many people come to my office and they're like, I'm tired all the time. And I'm like, how much do you sleep? And they're like, 3 hours.
Oh my gosh.
Like,
No.
like half my advice is my grandma's advice. Go to bed.
Put the computer away, put the phone down, and go to sleep.
And go to sleep.
Yeah,
Yeah.
that's a major issue too. That's a major
And
issue.
it is. And we laugh about that, but that's easier said than
Yeah,
done with lupus, right? Because you
yeah,
like not only does lupus cause you to be worried and also may have some effects on your sleeping patterns, but some
yeah,
of the medicines that we give for lupus, like
right.
steroids,
Yeah,
also keep you from sleeping. So if you're having a hard time sleeping, definitely strategize with your doctor to be able
yeah,
to figure out how to get those 7 to 9 hours.
yeah. That's really important. That goes right into our next question. Like, what other lifestyle changes would you recommend for lupus warriors to try to get the extra sleep or to feel better as they're dealing with lupus?
Yeah, for sure. The first thing I say is make sure everyone around you knows that you have lupus, right?
Mm,
So, a lot of us like to suffer in silence.
right.
Lupus affects women, especially women of color, the most. And
Mm,
we are the ones who like to put the cape on but
yeah.
don't like to put the one of my mentors says, about when you're in the plane, they say put the mask on yourself before other people,
Mm-hmm.
right? So we're the ones who like to put the cape on ourselves, but we don't like to put the mask on ourselves, right? So
Mm,
like I think making sure that everybody knows that you have lupus is really, really important
okay.
because you're going to need that support structure to take care of yourself well, right?
Mm,
You're going to need someone to do the lunches in the morning for the kids
right.
or to make sure you can get to bed on time and you don't have to do XYZ, or to encourage you if you're having a problem with your job, giving you the important time off, right?
Mm,
Um, that's really important. And then I think from a lifestyle standpoint, again, wellness, wellness, wellness,
yeah.
sleeping, having an exercise routine.
Mm,
And a lot of us, it's hard to move when you feel like you're in pain, but even things like tai chi, low impact exercise, walking,
mm,
yoga, things that you can do are going to help you with your inflammatory state.
absolutely.
Yeah.
Absolutely. And I think we sometimes we forget that just the simple things like walking
Yep. Yep.
make such a huge difference. It's like little small steps that you need to take.
Yep. Absolutely. Absolutely.
Awesome, awesome. Another question someone had was, how can I cope with the emotional and psychological impact of living with a chronic illness like lupus? That's a rough one.
That is a rough one. It's a really, 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 really rough one
That's so,
because your new normal when you have lupus is not the same as your normal before you had lupus. And I
right.
think the people who have the hardest time are the ones who don't approach it with surrender, you know?
Mm,
Um, you definitely have to fight lupus and do well with lupus, but you also have to surrender to the fact that, your before your lazy day might be your best day, you
yeah.
know? You do
And
your
that's okay.
That's fine. That's
Yeah.
okay. And, you know, um, I think taking that acceptance and
Hmm.
then not being afraid to ask for help when you need help, right?
Ooh,
So
yeah.
many of our lupus patients are going to need, social work help, social terms of, medications are super expensive. Getting your doctor is really hard, right?
Yeah.
Really take inventory of your life and understand where you need someone to help you cope. And then also, if you need mental health help, do
Yeah.
it. Get a therapist, get a psychiatrist if you need, right?
Yeah.
Um, all of those things will be really important for coping.
Absolutely. Absolutely. And even seeing a therapist, they can give you different coping skills
Yeah,
that might fit in your life,
right.
that will help you deal with it a little bit more.
Yeah,
That's a hard one to deal with though, because a lot of people just fail to really look at their mental portion of dealing with lupus. It's always about the physical, the pain,
right.
but our mind and our body connection are so strong.
And our spirit. And I mean, and I know not
Yes.
everybody has a spiritual practice, but whatever that is for you, whatever that looks like,
Right.
lean into that,
Mm,
that's going to help fortify you.
Absolutely. Absolutely. I love that. I love that. What resources, such as like support groups or educational materials, would you request, that your lupus warriors would read or take a look at just to be more educated and to help themselves understand what lupus is more?
Yeah. So there's the Lupus Foundation of America, which is
Mhm.
fantastic. It has a ton of wonderful information about lupus. It has support groups.
Okay.
And then also many of the institutions that have lupus centers of excellence. So I'm at Hospital for Special Surgery, and we have a very active social work group that not only works with patients individually, but has several programs that educate our lupus patients and even connect you with another lupus warrior who can
Oh,
become
nice.
a peer mentor, right?
Oh,
And
that's
so looking into that, yeah, NYU has a great lupus group, Hopkins has a great lupus group, UCSF, and UCSF actually has like a diet site for,
oh, wow.
yeah, so you can find peer reviewed evidence for dietary interventions. So,
Mhm.
just all of these pillar institutions are going to have good information. And then also the Arthritis Foundation will have good information as
Mhm.
well.
Yeah, I love those. I love those. So I've never heard of the UCSF. Is that what you call that?
Yeah, yeah, it's University of California, San Francisco. So they have an excellent lupus group, and they do a lot of work in health equity. I feel like if I was a West Coast girl, like I would be interested in that program, because
Right.
they do so much work on health equity, and then also
Mm.
on diet, lifestyle, integrative health, and lupus. And I think that they're a really innovative group.
Awesome. Awesome. We're gonna list those down in the comments a
Yeah,
little bit later so everybody can have that information because that's really good information to have.
for
And I
sure.
think that we overlook it sometimes. I know me as sometimes my doctor is like, stop reading. Number one, you don't know more than me. I know you know your body more than me, but stop reading and coming to me saying I should do such and such and
Uh,
such.
yeah, yeah,
How do
yeah.
you handle it? How do you handle that? That's
I
for a
actually,
doctor, how do you handle that?
I actually don't get like I see it as interest convergent. Because
Yeah,
first of all, it's great that patients want to know about their disease state and want to
yeah,
educate themselves, right? Not all the information that you find on Google is good information. A lot of it
right.
is bad information. But I just say, this is wonderful that you want to research this. Let me point you in the right direction. I can see that you want to learn. Here's some resources, right? Because
Here's
like
some viable resources, right?
yes, yes, yes. Because I mean, it's not that someone's questioning your expertise. It's that
Right.
someone isn't feeling well and wants to feel better.
Yeah,
So then you just acknowledge that want and then give them tools to feel better, right?
absolutely. Yeah.
Yeah.
And that goes so much with this first week of Lupus Awareness Month being it's our educate week.
Right.
So it's so
Right.
important that we know that people are educating themselves properly, not just through Dr. Google.
Yes. Dr. Google did not go to medical school.
Right, 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 right. And that leads us to you talked about health equity.
Yes.
And that leads us to another question that was posed to me maybe about a week or so ago. Are there any specific biases or misconceptions surrounding lupus that you've noticed among healthcare professionals or general public? And how can patients overcome these biases and receive the best care possible? That's a loaded question, but
That's a loaded question. Yes.
yeah.
So many, so many. Um, one of them is that lupus only affects women,
Mm,
and that's a huge deal because 10% of patients are men, and men with lupus have worse outcomes in part because when a man comes in and he has lupus symptoms, nobody says this is lupus
right.
and they spend forever not being diagnosed,
Mm,
right? And that price of delayed diagnosis is with a heavy cost. We know people who take longer to get their diagnosis are more likely to have severe features of lupus, more likely to end up with lupus kidney disease,
mhm,
more likely to have damage to their bodies due to lupus,
right.
more likely to go to the ER when they feel bad and then somebody gives them a bunch of steroids, which also
Mhm,
harms their bodies, right?
right.
um, we find a similar effect in ethnic minorities, right? So
Mhm,
even though we know that minorities are more likely to get lupus, minorities are less likely to get a diagnosis quickly and less likely to be sent to a rheumatologist in a timely fashion,
Mm,
and
wow.
less likely to know all of the treatment options for them, right?
And I think I've even experienced that, like not being told what new treatments and what you can use, the different things you can use.
Yeah, there's actually a study on this, 300 lupus patients, looking at black
Mm,
and white lupus patients. And has anyone ever told you about new biologic therapies for lupus? Black women were half as likely to ever have been told about biologics, let alone be put on biologics, right?
wow.
So, yeah. And the misconception is black women can't afford it, or minorities won't understand, or they don't trust the healthcare system, so they're
Mhm,
not going to want to take this medication, right?
mhm,
All of those things. Or my minority patients aren't going to trust this study, so I'm not going to offer them the opportunity to participate in research, right?
mhm,
um,
right, right,
all of those things impact how the populations that are most affected get care.
right, right. And this is not something that's just happening overnight. This is something that's
No.
been ingrained in the system for a while, correct?
Absolutely. Absolutely. This has been a part of medical racism for an
Mhm,
extremely long time. And we see it in any disorder that affects minorities more. And certainly lupus. And then lupus is kind of compounded because it's minority women, right?
right,
So a woman comes in and she says, I have pain here, I have pain there.
mhm,
She may not be taken seriously.
right, right. Why is my phone going off? Go
Uh,
ahead. I'm sorry.
No worries, no worries. Yeah, so I mean, I think it's a huge problem, and I think the other place is reproductive health.
Mm,
So there are so many people who think that people with lupus can't have babies. That is
mm,
dead wrong. Women with lupus can have healthy babies. Now,
wow.
getting the lupus under control, 6
Right.
months, making sure you're with an OB who understands all of the ins and outs of reproductive health. There's no reason why a woman with lupus can't have a healthy baby.
It's, that's so hard to convey to people sometimes.
It is. It is.
Because it's I guess because a woman's body is so it goes through so much trauma
Yeah.
when you're having a baby, and people are so afraid to
Yeah.
even, because of the misconceptions, to even try and conceive.
Yeah. And
Yeah.
when they do, some doctors are not informed. I can't tell
Yes.
you how many of my patients have been told, you need to stay on birth control. You should get an abortion. You should,
Wow.
yeah,
Whew.
yes,
Really?
yes,
Yikes.
yes. Or
That-
not offered. I mean, one thing that I try to make sure of is when my patients come to me, that first discussion, I also talk about fertility, infertility options, and fertility preservation, because, a woman might come in. And actually, I had a conversation with a lupus patient, made me change my practice, because
mm,
she told me about how she was diagnosed with lupus at a point where she could have had a baby or frozen her eggs.
mm,
And time went on, and she ended up with kidney disease, and she ended up needing chemotherapy. And
mm,
that completely changed her options. And
right.
she's like, I would love to have a baby now. I wish someone talked to me about this. And I said to myself, we need to be talking about this.
Right, right,
Like, why
absolutely.
are we not talking about options?
Right, right. Why are we not giving the options that they may have?
Right. And this
Oh,
is also, I mean, not to go on a tangent here, but
no, you're fine.
this is where systemic racism and reproductive rights and sexism meet lupus, right? Because
Mm,
the people who get lupus are minority women. And how often is minority reproductive health not only protected,
or
but
even
celebrated,
discuss. Yeah, yeah,
right?
yeah,
Yeah.
absolutely. It all, and it's funny because I'm thinking as you're talking, and I'm like, it all ties in together,
Yeah, it does. It absolutely does.
and we don't even realize it.
Mhm. Yeah.
Even if you're not of childbearing age, you still have people that are. So it's
Right.
definitely something that needs to be discussed. Definitely. Oh,
Right. Yeah.
that's a strong one.
Mm.
So that comes into like the common challenges that I want to go into next is
Mhm.
that bias, that racism. What
Yeah.
other challenges are you seeing lupus warriors deal with when they come to you? Maybe you're the new doctor
Right.
and they're telling you something else. What other challenges are you dealing with?
Oh gosh. I think one of them is that lupus is hard to manage,
Mm,
and that often when a lupus patient is not managing his or her care well, it's blame the patient. You
mm,
know, this patient is non-compliant, non-adherent, right? So
mm,
I've stopped using those words, and then I say, like if a patient is either not taking their medication, my
mhm,
next question is why. What are the challenges? Are you anxious about it? Can you afford it? Do you expect that you're not going to, you're going on disability soon and you think your insurance is going to change? And so, and there's always a reason. Like the reason is never, I don't want to get better.
right.
The reason is I'm not sure this medication is going to make me better. I had
Mhm,
this side effect, it wasn't tolerable, or
mm,
I can't afford it, I'm trying to ration it.
mhm,
Like those are the common reasons. And I think this label, like non-adherent, non-compliant,
mhm,
not only blocks a provider from knowing why, but also communicates to future providers that this
mm.
is challenging, right?
Oh, yes.
It doesn't follow directions, and then it's
Mm,
stigmatizing, you know?
mm.
And so now we're punishing a person twice for having challenges being able to care for his or herself.
Whew, that was a lot.
Yeah,
It's a lot.
yeah,
And you don't realize how the stigma comes about, but you just explained the whole thing.
yeah,
And
right.
it's just like, what do I do? You know?
Yeah. But
That's
and this is where I lean into some of my colleagues in their work, because there's Candace Fieldman who's up at the Brigham, and she implemented this nursing health program
mm,
where not only did she ask patients, what are your needs? Are you having a hard time affording? Did you lose your insurance? Can you get here often? Do you have childcare? Right?
right,
Are you dealing with accepting this diagnosis? Right?
right,
And so she asked all of these social determinants of health needs and had this nursing program then be able to address them. And I think one other misconception is, well, a patient might have life problems that are affecting their healthcare, but we can't help that.
right, right,
Actually,
right.
the vast majority of these problems, 90% of these problems were addressable by this nurse and social worker, right?
Wow, wow.
So if we just ask the question, we can actually improve the lives of our patients and lower those challenges.
Mhm.
But the mindset of our system is not to ask the question.
Yeah,
It's
it's almost not to encourage the communication to be so
I'm
full,
listening.
you know? Which one who was that? You or me?
That
Because
was
I
me.
know my thing keeps bugging out too.
Annoying. I want to turn it off. Okay.
I
Anyway,
tried. I don't even bother anymore. I just tell it to stop.
yeah, Siri is just real nosy. She
Yeah. She thinks
listen.
she knows everything.
Right.
But I mean, it's interesting. It's very interesting how that comes all about. Um, that goes back to something that I really want to talk about. It's the self-advocacy because all of that you just discussed can really stop us from advocating for ourselves
Right.
or stop us from telling people that we have lupus, whether it be our job or our family. How do you suggest that we deal with that?
Yeah. So the first thing is assess your relationship with your care team.
Mhm,
Do I feel like I'm being listened to? Do I understand my plan of care? Do I feel like my doctor would listen if I came up with a
mhm,
problem? Are there resources to help me in this medical establishment, right? I think one of the things that's important is, it's important to advocate for yourself, but it's also important to have a receptive ear. And if you're honest with yourself and you feel like no one in your health team, and some people don't live in a place with lots of rheumatologists, but maybe you have primary care doctors and you have
right,
one that's, really great and going to advocate for you. So I
right.
think, important to advocate for yourself. Make sure you have a listening ear. And then also, again, you don't have to take it all on you.
Mhm,
So I love it when my patients come in with family members. You
mm,
I have several patients who are doing so much better because now they have another person advocating for them because,
right,
advocate for yourself, but having lupus is hard. Okay.
right, right.
And
Yeah,
like,
yeah, you need help.
And there's a lot of things to remember, like,
Mhm.
you know,
Yeah. Yeah.
yeah, and even in cases where I've either had my own health issues or gone in with family members, when
Mhm.
someone is telling you your health status has changed, and
Mm.
lupus is full of health status changes, right?
Right.
You were
Right.
doing well and now you're not. You
Yeah.
were doing great, now your kidneys are affected.
Yeah.
You know,
Yeah.
all that. When you
Overwhelming.
when you hear that news, you don't hear anything else.
Right.
So now we're saying advocate for yourself in this scenario, right?
Yeah. Yeah.
Yeah, so I
Yeah.
mean, I think a having your voice telling people is important
Mhm.
because those are the people who are going to be your advocates when you really.
Mm. Oh, good point. Good point. That's a very good point. And like you said, you have to take off the cape. You've got to take off the cape. You've got to ask for help.
Right, right.
And you can't be afraid to accept that help. I think that sometimes that's an issue too.
Yeah, yeah, and it makes you feel guilty, right? Like, "Oh,
Mhm.
I've been doing this on my own, and this is what people expect from me," or, "This family is not gonna do as well if I'm not doing my part," or, "My job is not gonna do as well," or, "They're gonna judge me or fire me," or like,
Yeah.
it's important to know that there are workers' protections, and it's actually illegal to fire someone for having lupus or any other, health state or,
Yeah.
disability, right? So, there are protections for you. And so don't push yourself to do things that your body will not tolerate.
Right. And then end up in the hospital and they're looking for someone for your job.
Right. Yeah. What are they going to do if you all of a
Right.
sudden don't do your job because lupus took over?
Right.
They're going to
Right.
replace you.
Exactly.
Right.
Exactly. Exact. Quickly. Quickly.
Yeah.
Yeah. Absolutely. And that's hard. It's hard to tell people that you have lupus, even if it's your family, because half the people don't even know what lupus is.
I know. I know. I know.
You know?
Yeah.
But that's
Another
the perfect time for education.
right. And another reason to have those family members come to a doctor's appointment or come to if you're doing like a lupus foundation of america like talk or something like that, have your family members join the zoom,
Yeah.
right?
Yeah.
The more they know the better for you.
Yeah. Absolutely. And it makes you feel more comfortable in your own skin dealing with it.
Yeah.
Absolutely. Absolutely. I think this is one last question that we
Mhm.
have for you. Are there any new or emerging treatments for lupus that patients should be aware of? And how effective are these treatments, compared to traditional treatments like, steroids or
Yeah.
Celcept and things of that nature?
Yeah. So there this is a very exciting time in lupus
Mm-hmm.
because, for years, decades, right? We had one medication approved for lupus,
Right.
steroids, right? And
Yep.
steroids are really good at getting rid of inflammation quickly, but they're also really good for
Yeah.
damaging your body,
Yeah.
right?
Yep.
People who take steroids can get thinner bones, gain weight, more cardiovascular disease, diabetes, the list goes on and on and on and on and on, right?
Yep.
Right. And so, steroids, while they're great when you're really in trouble, are not great for the duration of disease, which is your life, right?
Right.
Um, so, and then we have steroids and then we have disease modifying anti-rheumatic drugs or DMARDs, which are
Hmm.
basically medicines that both get rid of the inflammation and also prevent lupus from damaging your body.
Okay.
So, that's your hydroxychloroquine,
Mm-hmm.
that's your mycophenolate, right? Those medications. But those medications also are sort of hammers, right? They don't
Hmm.
thread the needle. They're just, here's this way that we lower inflammation,
Right.
and people can have side effects.
Right.
Um, we're now moving into the age of biologic medications.
Right.
So, how do those immune cells that are overactive in lupus communicate with each other? What are the chemical signals that those cells use? And
Right.
can we change one small chemical signal to lower the level of inflammation?
Ah.
So, and it can be targeted to certain cell populations, right? So
Right.
we don't want to get rid of all white blood cells. We just want to get rid of these white blood cells, right? And
Okay.
so because those medications are, you know, more closely resembling your physiologic state,
Right.
and they're like much more threading the needle, much more specific, you have fewer side effects. And, you know, and some of them that have been out for a while actually decrease the amount of injury that people experience over time with their lupus.
Right.
So, I mean, I'm very excited about these medicines.
Yeah.
Um,
Yeah.
yeah, I mean, they're
I mean, you explained the biologics very good, because I always wondered, how do I explain like biologics? And you just
yeah,
explained it targets one specific thing that can help your whole body. So
right.
that's awesome.
Yeah. Yeah. So it's great. And I think the more of these come out, the more accessible they are to people. And the more we understand, you know, no two lupus patients are alike.
Right.
Many different kinds of disruptions in the immune system can lead to lupus.
Right.
And so the more we understand why your lupus is behaving this way, or are there different populations of patients who are more likely to respond to one drug or the other, the more
Right.
we have precision medicine. So not only do we have these biologics, but we can say here are the patients that will most benefit from them.
Right. 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 So awesome. So the outlook is very promising.
Yes, very promising. And
Awesome.
I think, you know, for a while when I first got into rheumatology, all my friends made fun of me because they're like, you just give steroids. And then
Oh Lord. Like, that is not all I do.
right. And then for a while, you know, someone like rheumatoid arthritis and psoriatic arthritis, all those medicine,
Right.
they got a ton of medicines. And like as a lupologist, my other rheumatologists are like, you just give steroids, and now
Look
I
at me now.
look at me now.
I love it. I love it. I love that everything is coming up, and everything is so promising. It just gives such a great outlook for lupus patients all over the world.
Yeah, for sure, for sure.
It definitely
Yeah,
does.
so it's
Thank you
exciting.
so much. Thank you so much, Dr. Blazer. I always love speaking to you, because I learn something every single time I talk to you. Every
Good,
single time. And I love it. I love it.
good.
Could you give me one piece of advice to give to lupus warriors
Oh
as
god.
a doctor?
Okay, can we do two things?
You can do as many as you want.
Because okay, I also didn't talk about other lifestyle things like protecting yourself from the sun and diet.
Okay, go ahead. Oh, yes, please. Let's talk about that real quick. Yes.
Protect yourself from the sun. Okay, so you know, and a lot of my lupus patients are like, I love the sun. It helps my mood, and I like to be outside, and I get it, right? But there are ways. So um, the sun is the most intense between 10 a.m. and 4 p.m. Right, so that's where you're going to get most of that UVB light. So if
Mhm.
you are a person who likes to take walks in the summertime before 10 a.m.,
Right.
after 4 p.m.,
Mhm.
okay, when you're on the beach, umbrellas, hats. There are actually these really cute hats that are like they have like UVB protection
Yeah.
in them.
Yeah. I've got this huge one. It's like,
Yes.
it almost covers my whole body. I love it.
And it's like super diva, right?
Yep.
It's like I don't have time to be out here with y'all, right?
Right. They're like,
But
who's
we can also
that? Me.
right, right. So hats, umbrellas, like going in the morning, and then you want 2 tablespoons of SPF, at least 50, every 2 hours. 2 tablespoons, 2 hours.
Okay.
Okay. Even for those of us that are highly melanated and have our deep chocolate color, we still
Right.
need, you
Right.
know, that kind of protection.
Hmm.
So that's what I tell my lupus patients. It's not that you have to never, ever, ever, ever see the sun, but you have to be smart and
Smart.
strategic about it.
Absolutely. Absolutely.
And then diet. So yeah,
You see my face, right?
I know. So the hard thing is that there's no one lupus diet, right?
Right.
But we do know that healthy eating practices do several things for our bodies. One is that you need to have antioxidants. So, like your blackberries, blueberries, you know, leafy greens, all of those things to help protect you from DNA damage, either from the sun or from lupus itself.
Okay.
And then you also need to make sure that you're avoiding too many processed foods, and animal fats, because lupus also increases the risk of cardiovascular disease later in life. And so you want a heart healthy diet. So, and I think having a great diet is doing something great for your body, and it
Right.
gives you a little agency and control. And I think psychologically that's really important.
Yeah. And then trying to just changing your relationship with food can help you do that.
Yes. And changing your relationship with your body. You know,
Oh,
like
oh yes.
like when you feel like your body is turning against you, and then
Yeah.
also you feel like it's not doing the things that you wanted to do, it's really easy to start to dislike the
Yeah.
body you're in, right?
Yeah.
It's
And to
easy.
just be negative to yourself.
That
Yeah.
negative self,
Yeah.
and where do we hold that negative self-talk? In our bodies, right? We
Yeah.
say, "Oh, stomach, you don't look good. I want you to be flatter," and we tense
Yeah.
up our tummy, right? We
Yeah.
say, "Oh, why can't you do this or that?" You tense up your shoulders, right? That lives in you. And I
Yeah.
think practices where you are doing healing things for your body, you're being nice to your body, really, really important.
Yeah. Just extending yourself some grace.
Grace.
I tell people all the time, at the end of the day, take everything that's in your head and just put it on a
Mhm.
piece of paper. I don't care whether it's good or bad, put it on a piece of paper. Take the bad stuff, crumble it up, and toss it in the toilet and flush
Yes.
it.
Yes.
Just
Yes.
the little things like that that can really remove
Abs-
that stress of just having lupus.
Absolutely. Absolutely. Yeah. So I guess that's my one thing.
I love it. I
Give
love
yourself grace.
I love it. I love it. Well, I'm so excited to be able to talk to you again. I'm so
Yeah,
thankful that you are here with us today.
of course.
Thanks for answering our question, asking a question. Thanks for answering the questions. And I so appreciate all of the information that you always give. So I want to be respectful of your time. If you have anything else that you want to say to us,
Um, I don't think so. I mean, I think this is such a great conversation, and I always appreciate you inviting me. Like I know you're like respectful of your time, and I feel like I could talk to you all day. Like it's just
yes. See, we'll be on here for hours at a time.
but nobody's gonna listen to that, so we should probably stop.
So we'll cut it short. I love it. I love it. Well, thank you so much, Dr. Blazer. I so appreciate you coming on. And
Thank
thank you, everybody, for tuning in. If you have any questions, list them down in the comments and we'll shoot them to Dr. Blazer. And if she has some time, she'll answer them a little bit later on.
you.
So thank you, everybody. We appreciate you coming and tuning in. Bye bye.
Thank you.